Hello and welcome to Askimo TV. I'm talking today to Dr. Elliot Sorene. Dr. Sorene is a consultant orthopedic surgeon and specialist hand and wrist surgeon at the London Clinic. Hi, Dr. Sorene, how are you?
Hello, yes, I'm well, thanks.
Dr. Sorene, today's topic of discussion is going to be rheumatoid arthritis. So what is rheumatoid arthritis?
Rheumatoid arthritis is an inflammatory arthritis, and this is as opposed to osteoarthritis, which is wear and tear of the joints, and the joints wear out after many years of use. Rheumatoid arthritis is when the body itself has an immunological problem, and where the joint is eaten away by inflammatory tissue. It doesn't just affect the joint, it also affects the ligaments, the tendons, the nerves. What we're talking about here is inflammatory disease.
So what causes rheumatoid arthritis and who's at risk?
Rheumatoid arthritis, no one really knows what the cause is, but it is does have a family history, and there are genetic causes. It's also, there are those who believe it's related to possibly a viral infection in childhood, but no one really knows, to be honest, where this comes from. It is more common in the Northern Hemisphere and Northern European peoples.
What are some of the signs and symptoms of this condition, and how does it affect the body?
Rheumatoid arthritis classically presents with multiple joints being affected. More often than not, it's a number of joints. The joints can present with stiffness, with swelling, and with pain. And it can also present with carpal tunnel syndrome and nerve compression, tendons swelling up. It can present with classically with hand and feet involvement, but it certainly can affect the neck, the spine, the shoulders, the hips, the knees, pretty much any joint in the body. And classically, it will be a number of joints being affected with pain and stiffness.
How do you diagnose this condition?
The condition is diagnosed by by classical history of pain and stiffness of a number of joints for a period of time. There are also a number of rheumatological blood tests which can diagnose this condition, and this is where it becomes complicated because some patients don't actually have positive findings in their blood tests. And classically, the definitive diagnosis will be undertaken by a rheumatologist, an expert in rheumatological conditions.
How is rheumatoid arthritis treated?
The most important thing in the management of rheumatoid arthritis is this is what's called a multidisciplinary team approach, and it's not just one person that manages this condition. It's the rheumatologist who deals with giving medication to patients with rheumatoid arthritis and the initial diagnosis. Then the patient will be managed with painkillers, physiotherapy, occupational therapy, hand therapy, splintage. The patient will need to possibly be on disease-modifying medication, quite strong medication. And once the medication doesn't help in certain joints, then a surgeon may be involved. And if it's the hands involved, then it's ideally will be a specialist hand surgeon. And the management will be according to what the problem is. Often patients need to have nerve releases for carpal tunnel syndrome. Tendons can be engulfed in rheumatoid tissue and may need to be released. And joint deformities can be addressed by either moving tendons around to make the joints more stable early on in the deformity, or once joints are destroyed, there's the option of either fusing joints or replacing joint replacements. And once again, in the hand and wrist and elbow, this will be a hand surgeon, but then again, this does also affect the hip and the knees and the feet and the spine and the neck. So often these patients have seen a number of doctors and are managed by a number of different surgeons, in addition to their rheumatologists, their occupational therapists, and their physiotherapists.
Can this condition be cured, or is it about lifestyle management?
Well, they do have very new medications now, very strong medications, to what's called disease-modifying medications, immunological medications. The new medications do, in fact, greatly improve a lot of the symptoms, and they do stop the progression to severe deformity. So the mainstay and the gold standard of treatment is to manage the patient's medical condition. It can never be totally cured, and it can always come back once a patient has established rheumatoid arthritis. However, certainly 20 years ago, when we saw a large amount of patients progressing to needing joint replacements, many of these conditions are managed and do, on a day-to-day level, have very productive lives, and it doesn't affect them as it did in the past.
Thank you. Thank you so much for speaking to me today.
You're welcome.